All right, we're going to do 2 more questions. The next, I think, is going to be of some interest to the people in the room. Small businesses, it says, are funding a large portion of the health care bill. Tax benefits are given to those who employ with an employee average wage of $50,000 per year. And as such, a disproportionately lower tax benefit will be given to states with higher average salaries, such as California. What is your view on this? And I guess it's probably an opportunity for people to tee off and talk about healthcare reform and the legislation that was passed into law this last year. And we'll have 90 seconds, and we're going to begin with you, Mr. Taylor.
The Speaker of the House stated, "We need to pass this bill so that you can find out what is in it." I think she meant so they could find out what was in it. Senator Max Baucus, he was one of the key authors of the bill. He initially promoted a 13% payroll deduction for the health care bill to pay for it. 13%. Max receives $3 million in campaign contributions from insurance companies. Go figure. Health care bill was passed without bipartisan support and without being read by the legislators who voted for it. We've only begun to find out about the problems and the inequities and the unintended consequences of the health care bill. We need to revisit the entire piece. We need to repeal the bill. We need to start from scratch. We can do this. We can provide sound, fiscally responsible health care services for every citizen in the United States. But it is not the government's responsibility to provide this. It is not an entitlement. It is not in the constitutional Bill of Rights or any of the amendments. And any right that is not in the Constitution of the United States is reserved for the states. The states can take this issue up on an individual basis if they wish, like California has, but not the federal government. We can, though, as the federal government, champion and promote cost-cutting effective measures like tort reform first and foremost. That will take tremendous cost out of the healthcare. Thank you very much.
This one is going to be a short answer on my part because thank you, I'm sorry, this will be a short answer. I just cannot support the healthcare bill. When it first came out, I did read quite a bit of it, and it is a disaster. I can't find any way to try and make it work and